All right, thank you very much for tuning in. I'm Dr. Theron Muller from the University of Toyama, and this is a presentation I'm going to be giving June 22nd, 2019 at the JANET conference in Nagano, the Japan Association of Nurse and English Teachers. And so in this presentation, what I'm going to be looking at is the feedback given to a student preparing for a medical exam from a language teacher, me, and then from a healthcare professional, my father, and the differences between the kind of things that we pointed out to her as we were working with her to get her ready to take the USMLE exam. This is the first kind of small-scale research I've done since graduating with my PhD in November last year, and so it was nice to do something that has absolutely nothing to do with my PhD. It was kind of a refreshing experience for me. So let me get started. I just want to give some background. The United States Medical Licensing Examination is the three-step exam that medical students need to take in order to qualify to do residencies in the U.S. And the particular part of the exam that my student asked for help with was the clinical skills exam, which is intended to have the examinees interview mock patients and do a kind of mock physical exam with the mock patients, and then write up a patient note giving some kind of recommendation for what tests need to be done and some kind of tentative diagnosis of the patient's problem. So the literature, the background that informs this study, I approach this kind of conscious of Watts and Todd's criticism of ESP's focus on the content of teaching rather than methodology. And I also approach this project with a belief in a social construction of knowledge, which includes participating in a community of practice, something that's also compatible with the social dynamic view of language, learner agency, and motivation, where you see language learning as occurring through social interactions, through talking with people and discussing things and communicating with people in a kind of social environment, which becomes important when we get into the data that I'll be sharing with you today. So the background for me is I'm an associate professor formerly affiliated with the Medical and Pharmaceutical Science campus. So until February this year, my office was at that campus, and so all the sessions that I did with the student were there, and because she was studying there, it was easier for her to visit my office to do these practices. I have a master's in TEFL and a PhD in applied linguistics, and I've looked at applications of discourse analysis to medical English lessons, but as I started working with a student, I quickly realized that I kind of had a big gap. I don't have any formal experience with medical licensing examinations, and so I didn't have any expertise to help her to get ready for the exam. I could critique the contents of the exam, I could examine the language used in the textbook that we were using to help her prepare for the exam, but it was difficult for me to know what the parameters of the exam were to tell her what she was expected to do in order to do well in the exam. So, with that in mind, I asked my father if he would be willing to help. He's a Kansas board certified oral surgeon with more than 10 years of practice of dentistry in the U.S. Army, and then more than 20 years of private practice in oral surgery. He retired about 5 years ago, but he retained his licenses and qualifications until now. And so I felt like he maybe missed talking about this kind of thing, doing this kind of thing, not necessarily missed seeing patients, but missed thinking about the kind of craft, of the kind of medical craft that he spent a lot of his life training for. And so I thought that this would be a good chance for him to share his expertise with somebody and to also help me to prepare the student to take the exam. So I really wanted to share more data with you, but because of time constraints, I'm just going to share one quick extract from our first session that we did on November 2nd, another quick extract from the first session that involved my father on December 14th, and then I'll compare and contrast the kind of approach to feedback that we had. So this is what the exam book basically looks like. These are some scans from it. So you get kind of information about the patient, you get some cue for the mock patient, who's me in this case, and then there's a series of, there's like 3 pages of questions and then the patient response. And the way it works is the patient is, if the doctor asks you the question, you answer it, but you're not supposed to kind of volunteer the information. It's the mock doctor's job to ask you the question in order to get the information out of you. So there's kind of two parts to these interviews. There's the beginning where there's kind of a oral interview with the patient, and then they switch to do the physical interview. And so the part of this session that I'm going to share with you is when the student, when we're in the practice session, when she makes that switch from doing the interview to doing the physical exam.
I need to do a physical exam. So before I begin, let me sanitize my hands.
Okay.
Okay. Then I wash my hands, and okay. I need to untie your gown to examine your. No, I need to check your head.
Yeah.
Yeah.
This has the exam component here.
Palpation.
Head, facial sinuses, temporal mandibular joints.
Oh, wow. Okay, there are a lot. And neck exam and euro. Oh my god, there are a lot of things to do. Okay, I skipped it. Yeah.
Okay.
Where is it? Thank you for letting me examine you. On the basis of the information I gathered.
Okay, so let me just give a little bit of an analysis of this. So what you have here is the physical exam components are skipped and or they're kind of considered unproblematic. It's part of her medical education in Japan to have done some, to understand and be able to do these exams in Japanese with patients, and so they aren't something that we really concentrated on in the sessions. I explicitly told her not to worry so much about the 15-minute timeline. I said it's better to do a good interview and then try to make it faster, as opposed to worrying about timing and also worrying about what questions to ask. We basically followed the questions in the textbook, and I kind of found myself flipping back and forth between pages to find answers. I didn't examine the purpose of the question so deeply. There was attention to the specifics of particular cases. So in this case, she needs to do the fundoscopic exam. She needs to check the temporal mandibular joints. So those were the kinds of things we talked about, as opposed to a kind of overall consistency in the examination. And then finally, we considered the conversion of that interview to the written patient note relatively unproblematic. She would write a patient note, and then she would ask me to do some proofreading of it, but I wasn't quite sure what was expected in a patient note, so it wasn't clear to me what kind of feedback to give her. So the next example is from the first session where my father got involved. And what I have to do first is I have to explain this particular procedure that she's going to try to do, which is this Lermite sign procedure, where you push the patient's head down and then they're supposed to feel some sensation. And this is the example extract. And I forgot to mention earlier that I didn't, because of the space available on the slides, I haven't transcribed everything that you're going to hear. I've tried to just transcribe the important parts. So if you could just explain one more time. So you're doing this test, and then go ahead. You can start your explanation.
I'm going to bend your head forward, and if you feel any electric sensation, please let me know.
Yeah, so go ahead, Dad. Did you want to say something?
I don't know what she's been taught in medical school, so you'll have to use what she's been taught. But instead of taking your hands up here and saying, I'm going to bend your head forward like this, I would just say, we're going to bend your head forward and forward towards your chest. And when I do that, you might feel an electrical sensation down your arms, your back, your legs somewhere. So if you feel electrical sensation, please let me know where it is.
So
I think you need to demonstrate by moving your own head and all that, because I think that takes, you only got 5 minutes to do this exam, so that you want to not waste any time because I don't think you need to. So unless you was taught something different in school, that's what I would say. When I did an exam with patients, I didn't go up to them like this and say, I want to bend your head. I just say, I'm going to bend your head forward toward your chest. You might feel an electrical sensation, and I sometimes just get a sensation down your legs, your arms, your back. If you do, let me know where you feel that sensation.
That makes sense to me. Let me double check if understands. Okay, so here she's going to be doing that Lermite sign, and what she does is she says, I'm going to bend your head forward, and she demonstrates it, and then my father jumps in and he gives this feedback saying that he's skeptical of doing the demonstration because, one, it takes extra time, and then later as the extract goes on, he's kind of critical of doing gestures in order to explain yourself. He says it's better just to explain yourself orally. From a language teaching perspective, doing the gesture seems like an effective communication strategy, but from his perspective as a medical professional, he says, no, I don't gesture what I'm going to do to the patients. I say what I'm going to do to the patients, and then I do it. And as the conversation goes on, there's some background to why she's doing these gestures that I'd love to get into, but this is the main point that I wanted to talk about today. So just a quick discussion, some commentary on this. So the physical exam components are considered problematic. Even her using the stethoscope to listen to my breathing and my heart sounds. He gave her advice about how to do that more quickly, more efficiently. He was really worried about the timing of the interview. He wanted to make sure that we got it done in 15 minutes. He was concerned about the purpose of the questions being asked. And related to that, he wanted kind of an overall consistency or coherence in the examination. What he said was if she walked into the exam room and was thinking about how to order the questions to ask, that was problematic because that takes too much mental energy, too much space. Instead, she should walk into the room with a list of questions ready to ask instead of trying to order the questions as the interview proceeds. And then he was particularly concerned about converting the interview to the patient note, and gave her a lot of feedback on the patient note itself and how to write a patient note that meets kind of his understanding of expectations for patient notes, and also that resembled the patient note examples that were in the textbook we were using. Okay, so what are the takeaways from this investigation? Well, one is that students may request language help, but their needs may be quite a bit deeper than just kind of a surface language help. They may need what I described as socialization into the practice that they're seeking to gain access to. So medical practice in the U.S. It's important to consider expert perspectives in instruction delivery where possible. I was really lucky that I could enlist my father. I don't think that I could have been nearly as successful in preparing her for the exam had he not agreed to join us virtually. And then I think that socialization model of practice and expertise is important, and particularly local knowledge may be insufficient for this. So local doctor at the hospital that she had talked to said to gesture because Japanese explaining in English may not be able to get their point across, so just go ahead and gesture and then the patient should understand what you mean. And my father picked up on that and said he didn't consider that particularly good advice in order to do well in the exam, in order to ultimately do well in the exam. And the good news is, the nice takeaway is that my student did pass the exam, and so she was successful. She went to the U.S. and she was successful in taking the exam, which is excellent news. Okay, so next what I wanted to talk about was what are some of the potential implications of this information for nursing English, and I've got two examples that I wanted to go through. One example is from an activity in one of the textbooks that I use where there's two nurses talking and they're discussing how to spike and prime an IV bag. And my students don't understand what that means, and so I was interested in trying to find a video that explained what spiking and priming the IV bag means and some language to use to describe what you do when you spike and prime the IV bag. So I found this YouTube video, and I'm just going to play just a few seconds of it.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to demonstrate for you how to spike an IV bag and prime the tubing. So what does spike and prime?
Okay, that's enough. So actually let me go just a little bit further here.
Mean.
So I purposely advanced it so that she's not blocking her hair, because when I was in my apartment looking for videos that would meet the needs of my students, my wife, who's a nurse, happened to be there too, and I was playing this video, and she looked at this video, and her first comment was, her hair is an infection hazard. She shouldn't have her hair hanging down like that. And so I think it's important to note that this is kind of a demonstration, right? This isn't an IV bag that's going to be going into a patient. This isn't tubing that she's going to be using to insert into a patient. This is all kind of a demonstration for the purposes of this video. But while the language may be fine, the presentation, at least according to my wife, is problematic because a nurse who has her hair hanging down like that wouldn't be acceptable, at least in the hospitals that she has experience of working in. So then the question, that's something that I completely missed, that was completely beyond kind of what I was looking for, what I was conscious of when I was watching the video. And so it's interesting to me to think about the kind of cues that professionals pick up on versus the kind of cues that a language profession, or the kind of cues that a medical professional may pick up on versus the kind of cues that a language professional picks up on. I was only interested in the language that she was using, whereas my wife was interested in, is this realistic as a framing of a nurse in practice, doing an actual procedure in practice? And her answer was no. Okay, so I've got one more example here. This is from a section in the textbook where the students have done, there's a dialogue in the textbook where they practice inviting a patient into the ward, and the kind of the initial interview that nurses do with the patient. And doing the interview in the textbook's fine, but what I wanted to do was to do a kind of more customized task. So I wanted them to have a new patient, not a patient based on the textbook, and I asked them to kind of imagine a patient, and the dialogue is supposed to be in English, so I asked them to imagine what's the problem with the patient and why are they speaking English with the patient, to kind of create a more realistic atmosphere. And I also wanted them to have 2 questions that the patient had ready to ask them. And they do have 2 questions that are appropriate. Could you prepare a wheelchair? And then how long does it take to recover my foot? And you can kind of see that they put that second question in parentheses, so they can also tell that it's not really a serious question. Do you have a boyfriend? If not, why don't you become my girlfriend? And I think the point here is that these students are first-year nursing students, so they're at least 2 years away from when they have to go do their nursing practicum. And if they were doing this as part of a nursing practicum, it would be completely inappropriate, and the instructor would have to kind of call them out for it. However, in a first-year English language classroom, playing with language, enjoying yourself, kind of enjoying the process is an important part of language acquisition, is an important part of language learning. And so the question I kind of ask myself is, how much, as a teacher of first-year students, should I push them to take these activities more from a perspective of kind of serious nurses giving feedback and nurses interacting with patients, and how much should I let them kind of play and have fun with the language and have fun with the activity and enjoy themselves, as opposed to thinking of themselves as actual nurses dealing with actual patients in the hospital? And I don't have a good answer to that question, but I thought it was one worth raising. In this particular case, this card, when I passed the cards out to the students to do the activity, this particular card I took out so that I didn't pass it out to anybody, so that nobody had to deal with this question. There's another case that I didn't show, which I felt was even more appropriate, which was when male nurses, when they were making an activity, were asking the patient, the female patient, if she had a boyfriend, and then if she would be their girlfriend, which is even more appropriate and is even more inappropriate and even more problematic in my mind. But again, they were enjoying the activity, and it was an English activity, and they were first-year students, and so the question is, how much do I jump on them for that, particularly because I'm not a medical professional. I'm a language teacher. That's my specialty. So that's all for my presentation. Thank you very much for your attention. If you have any questions, you're more than welcome to contact me and let me know, and I'll try to answer them as quickly as I can. Thank you very much.